So the lipids that accumulate in Gaucher disease is primarily a molecule called glucosylceramide, and basically that is a sugar that is linked to a fatty acid and to another type of lipid called sphingosine. And in Gaucher disease, when there is a deficiency of this enzyme, glucocerebroside, the primary lipid, builds up. And the way the cell reacts to that is to find an alternative channel to get rid of that lipid. And one such way is that it converts this lipid to what's called glucosylsphingosine by snipping away the fatty acid. So you've got glucose and sphingosine, so-called lyso-Gl1. Unfortunately, this is a very harmful lipid. It's very, very toxic lipid, and it is very potent in causing immune activation. So we've learned that this lipid acts like an antigen, just like a virus would in a simplistic sense, and it activates a group of cells called T lymphocytes. And a subgroup of these cells are particularly affected by this lipid called NKT cells. And these NKT cells, natural killer cells, have very potent ability to stimulate B lymphocytes in the body to make antibodies. And these antibodies are directed against the lipids that accumulate in Gaucher disease. And so if this process of continuous immune stimulation and B lymphocyte proliferation leads to antibody formation, and eventually in some patients it can trigger the development of myeloma or a precursor of myeloma called MGUS, otherwise known as monoclonal gammopathy of unknown significance.